Hi, this is Ryan Kelly, Managing Editor for the Journal of Emergency Medical Services, and I'm here with Brenda Staffan, who is one of the EMS10 Innovators in EMS Award winners for 2016. Brenda, it's so nice to have you here today.
Nice to
meet you. Very nice to meet you.
Thank you.
So Brenda, you are one of the kind of first services in Reno, Nevada to have a community paramedic program, probably even before the term community paramedicine was even coined. So can you tell us a little bit about how things got started in the 80s?
In the 80s?
Yeah.
Well, REMSA is the recipient of a Healthcare Innovation Award funded by the Affordable Care Act. And REMSA's grant project was to implement community health programs. We had actually 3 interventions, community paramedics, and also the REMSA Nurse Healthline, and a 3rd intervention to transport patients to alternative destinations.
And when did those start?
So the grant was awarded in 2012. We launched each of those programs in late 2012, early 2013. And really our goal was the triple aim, to improve the quality and experience of care, to improve the health of our population in Washoe County, Nevada, and also to reduce the overall cost of care. We were one of 6 grants awarded as a part of the Healthcare Innovation Awards that were for paramedics or emergency medical services providers. So we were grateful to receive one of the round 1 grants. 105 in the nation were awarded.
Wow.
And REMSA was one of those 105.
And so that was in 2012.
2012.
So how have you been continuing to fund these programs through the present day?
Right. So as a part of our Healthcare Innovation Award grant program, we had a very rigorous measurement strategy. So we had a goal, as I said, to improve the quality and experience of care for our patients, but also to generate savings that could be reinvested back into our community. And so we have sustained the programs by showing a tremendous improvement in reduction in ambulance transports, hospital admissions and readmissions, and also ED visits. And specifically our community paramedics are visiting patients in their homes after they've been discharged from the hospital, performing medication reconciliations, educating patients on their care plan, and also performing point-of-care lab tests in their home, and making sure that they can really transition from hospital home and improve their health.
Wow, and so do you use community paramedics? Are they recruited as community paramedics, or do you bring in providers who were on the ambulances and performing emergency care and train them up?
So yes, we recruited and hired and trained 10 community paramedics in our first class. They received about 150 hours of training, and the training included more depth of knowledge about managing the diseases that they would be working on, specifically congestive heart failure, post-cardiac arrest, post-MI, and also COPD. So they received additional education on those 4 diseases. And also other skills such as motivational interviewing and working with patients to help them follow their plan of care. So we have now trained another 7 or 8 community paramedics, and we have great contracts now with clinical partners, hospitals, also commercial insurances. And we're very excited in 2015, which is now being implemented in 2017, the state of Nevada passed enabling legislation, and so community paramedic is now a certification in the state of Nevada. And the Nevada Medicaid program approved Medicaid reimbursement in the state of Nevada, and we are actually billing this month CPT codes for community paramedics for Medicaid patients in Nevada.
Wow, that's amazing.
So very
that
exciting.
Sounds like a very difficult, long process, but it must be great to see that actually come to fruition.
Yes, so it was originally a 3-year grant because our results and positive patient satisfaction surveys and increased patient quality of life was so outstanding. We were extended to a 4th year, and we just completed the grant in June of 2016. And now, as I mentioned earlier, we have these sustainable funding sources from Nevada Medicaid, a commercial insurer, and hospital systems. And we're working on more. We have a new arrangement with the hospice program that's about ready to be implemented. And we're also utilizing community paramedics for on-site visits for workplace injuries.
Wow.
So we're really expanding our program to meet the needs of our community.
Wow, do you foresee this as something that other states might be able to model? I mean, not every state, of course, but perhaps other states might be able to look at Nevada as a model for sustainable funding for these kind of initiatives.
Well, that's certainly one thing that we're working very diligently on, is taking these positive outcomes and these savings and working with more commercial insurers, expanding the Medicaid program, and then also working with our national associations on Medicare payments as well. So yes, we are working to, as CMS calls it, to replicate and expand these programs, not only geographically, but as you said, across other states. There are other exciting community paramedicine programs around the nation, the MedStar program in Texas and Minnesota and Idaho. California just completed some pilot projects. I believe there are about 250 pilot projects around the United States. But as I said, there were half a dozen that were funded by these major healthcare innovation awards. So we, our team, our community paramedics, and our nurses, our registered nurses that work in the REMSA Nurse Healthline, have done a phenomenal job of serving our community. I might want to actually now mention the REMSA Nurse Healthline is a 7-digit number available to the entire community, where registered nurses are co-located in our medical communications center, and they are taking non-emergency calls.
Wow.
And they have an evidence-based algorithm called the Emergency Care Nurse System, where they're interviewing the patients on the phone, identifying what their medical need is, and then identifying, according to a protocol, a recommended level of care. So self-care at home, make an appointment with your primary care provider, go to an urgent care center, and yes, if they have an emergency medical condition, they can refer to the ED or a 911 call. But most importantly, the nurses are recommending a location of care that is closest to their home, that accepts their insurance, that is open and specifically meets their type of need. So we've also been able to avoid ED visits and avoid hospital admissions by providing access to those nurse triage services throughout our entire community. We're now serving the entire northern Nevada region, 13 rural counties, in addition to our home county, which is Washoe County, Nevada.
Wow, that's an amazing accomplishment to really meet the healthcare needs of everybody in the area.
And not all insurers provide access to a nurse by phone, so that's an exciting new innovation that emergency medical services providers can deliver. And then our third intervention is transport to alternative destinations. So oftentimes people dial 911 and maybe they don't have a medical emergency. And presently in our EMS system, we could only transport to the emergency department. So now under the grant project, we're performing an advanced assessment in the field. All of our EMTs and paramedics received 4 hours of training to perform that advanced assessment. And they also are identifying within a very specific medical director approved protocols, they're identifying a more appropriate level of care. So we're transporting intoxicated patients directly to the detox center, behavioral health patients directly to 2 mental health hospitals, and low acuity patients to urgent care centers and our 2 federally qualified healthcare clinics. So we're able to actually navigate patients to the right appropriate level of care that is best suited for their needs, and again, avoiding ED visits, unnecessary ED visits, and unnecessary ambulance transports.
Keeping those resources available for people who really, really need it, and instead of people who can get help and good help elsewhere.
And hopefully those savings are being reinvested back into our community and expanded access to primary care services, expanded access to mental health services. And so we've been working with the state of Nevada, the governor's office, the legislature, and also the Medicaid division and the EMS office to identify those savings and then reinvest them in our community. The University of Nevada, Reno School of Community Health Sciences was our measurement partner, and so we're very excited very soon to be releasing our data in a more public way so that we can share the results of these 3 interventions.
Wow. Well, we can't wait to see that and really see how it has affected change.
Yep.
Thank you for talking with us.
Thank you. My pleasure. Thank you again.
And congratulations.
Yes, thank you.
This is Ryan Kelly for the Journal of Emergency Medical Services, and I'm here with EMS10 award winner Brenda Staffan. She's one of the EMS10 award winners for 2016.